Okay, I'm Dr. Shashank Doshi. I'm an endocrinologist from Mumbai, and with us we have a living legend of diabetes in the world, Professor V. Mohan, and Professor Anjana, who is a world researcher in diabetes and one of the foremost researchers from India. And unfortunately, India is the largest population on planet Earth. We also have the largest number of people living with diabetes on planet Earth in India, whether they are type 1 or type 2. And the footprint of the diabetes map of India on the world, the foundation of that was laid by Professor V. Mohan and his team as a part of the ICMR INDIAB team. And Professor Mohan, his research, which was ably led and forefronted by Dr. Anjana, and congratulations to her. She got an award on the World Diabetes Day from the Indian Council of Medical Research on health research excellence. Congratulations to you, ma'am. And Professor V. Mohan has actually designed this entire study in 28 Indian states and 8 union territories. And it mapped 101 people living with diabetes in India and 136 million people living with pre-diabetes. Just a day back, WHO actually changed the numbers with A1C, and you must have seen a Lancet report which doubled the numbers. That's what we are going to dialogue with both Dr. Anjana and Dr. Mohan today. But before that, I would like to tell that her whole idea is to generate awareness among people at large about diabetes. And India being one of the largest population in the world on diabetes, we should screen everybody with diabetes if possible above the age 20 or 25. We should ensure that if your waist circumference for a man is more than 90 centimeters or for a woman is more than 80 centimeters, or if your family history of diabetes, you should regularly screen or get your sugar checked. And you should follow up after that with a doctor, follow diet, exercise, and follow simple ABCDE principles. That means try to keep your 3 months average sugar below 7, try to keep your blood pressure under control, cholesterol under control, do diet, do exercise, and try to take care of your feet. Because we all believe that we should be the diabetes care capital of the world. So Professor V. Mohan, congratulations to you and Anjana. You are the world leaders, and you have ensured that you have done the largest epidemiological survey on planet Earth from ICMR INDIAB. And last year we had a seminal publication. And we will discuss the kidney paper with ma'am, which is not in public domain, and the complications and diet paper. But sir, what is your comment on this WHO statement which has come out yesterday, which is a little disturbing, because it's very unlikely that we have suddenly doubled up from 100 to 200 million. And a lot of people were anguished and confused, including the press and media. And you being the foremost authority in this direction, we would like to know your science and evidence-based views. Remember, Professor V. Mohan represents the evidence-based medicine, and he has more than 2000 plus publications. He is one of the highest published researchers on planet Earth with a H index more than 150. Professor Mohan.
Thank you, Dr. Shashank Doshi. So, this report that you mentioned was done by Imperial College, but with the WHO's consent and WHO's request, they have done that. What they have done is to look at the prevalence of diabetes in some 200 countries or so. Now, in most of the countries, what they do when they do a survey is to do a fasting blood sugar, and many countries do just that. And others do a fasting blood sugar and a HbA1c. Now, HbA1c is a very good test as far as assessing control of diabetes. If you are under control or not, and somebody is already diagnosed, it's a fantastic test. It is a gold standard. However, for diagnosis of diabetes, HbA1c is not such a great test, particularly in countries like ours where there's a lot of anemia, hemoglobinopathies, and drugs affecting it, and many other things. Also, the other problem with HbA1c is it goes up with age. Glucose doesn't go up much with age, but HbA1c does go up with age, which means at 60, 70 years, if you take a HbA1c cut point of 6.5, which is used for diagnosis of diabetes, you'll find a lot of normal people who have HbA1c of 6.5. They'll all get included as diabetes. Now, in this study, what they did was they used the same data of the ICMR INDIAB study, which we published last year. So, the data is not new. No new data has been collected. But they looked at the old data, but where we had used the gold standard of the oral glucose tolerance test to find out the numbers of people with diabetes, they used HbA1c. And when they used HbA1c, they got a very high figure of 200 million people. Now, one can't say it is wrong, because many people do use, for example, in the US, they use HbA1c to find out. But in India, as you know, RSSDI, ESI, and all, they have not recommended HbA1c because we have shown that it leads to inflated numbers. So suddenly from 101 million, which is the number if you use OGTT or fasting, by using HbA1c, they came to this number of 200 million. Not only that, where China was ahead of us, by using this number, now India becomes 212 million and China is 148 million. So we actually become the diabetes capital of the world with this. I wouldn't worry about this because I won't say which is right or wrong, because some people, because they are saying OGTT is being given up, nobody is using it, so we have to use this only. So I won't say it's right or wrong, but you must remember it's the same study, so no new study has been done. So if you say that the number has gone up from 100 million to 200 million in 1 year's time, that's wrong, because the same study only has been used.
Thank you so
but
much.
The interpretation is that if you use HbA1c, you will get a lot of people who are counted as diabetes, who have probably very mild glucose intolerance. That is why these inflated numbers.
So thank you so much, Dr. Mohan. So remember, this was Dr. Mohan's study only,
Yeah.
from which they extrapolated this data and did a computational analysis and tried to do a erroneous or may not be erroneous
Not
reading,
erroneous, it's another set of
but the
criteria.
interpretation. So don't get alarmed, don't get scared. There is no need to be fearful. India has a large prevalence, but the percentage of prevalence still remains around 11%.
Correct.
So, Madam Arjana, congratulations once again. As I said, you are the foremost researcher now in this space, and you are future of India. And you know, 40% of Indian population is young, and you represent the young brigade, and you represent a very mature brigade of young, mature India. So, how do you interpret the prevalence of diabetes, and how do you see the trends across India on diabetes in different geographies? Because India is a very diverse country, a lot of cultures, and you have actually gone and traveled the neck and breadth of India, 700 districts in India. Ma'am has gone to every state, every union territory to map this study personally. And she has personally supervised this entire study for Dr. Mohan's Diabetes Center and ICMR. So, how do you see this heterogeneity and diversity? What are the common things and what are the unusual things?
Thank you, sir. That's a really important question. So, India is diverse in everything, right? Whether it's climate, geography, taste, language, whatever. And so the diabetes prevalence is diverse as well. If you look at the highest prevalence states, they're mostly in the southern region, and some part, there's Punjab, Haryana with a little bit of high prevalence there. But the highest prevalence would be some parts of the north and most of the south. The lower prevalence states are in the central part of India, the Bihar and adjacent states. That's where the lowest prevalence is as of today. But the interesting thing there is, when you look at, that is diabetes. If you look at pre-diabetes, they have the highest pre-diabetes number. So we all know that those with pre-diabetes, about 60% of people will convert to diabetes within a 2 to 5 year period. So when you see such a high prevalence of pre-diabetes in the states that have low diabetes prevalence, what does it tell you? It tells you that all these people are waiting to convert in the next few years to come. So that is a very important point. The other point that we have here is the urban-rural differences that we have. In diabetes, urban areas have much more diabetes than rural areas. Actually, they have double the prevalence of diabetes, but in pre-diabetes, they're equal. So again, here's the problem. 70% of India lives in her villages. So even a 1% increase in prevalence translates to absolute numbers going in millions. So therein lies the problem. In rural prevalences, as it increases, the burden on the healthcare system, your providers, families, individuals, all of this, it's definitely a problem.
Thank you so much, ma'am, and congratulations to you and sir. And we wish everybody a very happy World Diabetes Day. And I'm happy that both of them could join us to give this important clarification and this seminal work which has been done. The key to diabetes is prevention and care and control. And most important thing in life is to not only look at health outcomes but also happiness outcomes. Be mindful. And Professor Mohan not only is a unique human being in terms of medical research and treating people living with diabetes, but also has a spiritual side to him. Om Sai Ram, sir. Thank you.